Okay, so the sitting is resumed. It's time for questions to the Minister for Health, and we'll start with a list of questions. Questions 2 and 7 are withdrawn, and I call Cathy Mason.
Question number 1, Lidhull.
Minister.
They indicated that as Minister, one of my immediate priority areas, subject to available resources, is actually enhancing primary care. So I was pleased to announce recently that the 24-25 GMS contract has been agreed, and a key aim of the new contract is actually to provide GPs with greater certainty over their income throughout the year, as well as actually reducing the administrative burdens and associated costs to practices. To support that, the 24-25 contract brings the Quality and Outcomes Framework, previously known as QOF, and Specified Enhanced Services, actually into the core contract, so under the clinical care domain of a new contract assurance framework. So the associated funding is incorporated into the core contract. So in addition, funding that is provided for clinical waste will also be repurposed into core GMS funding. And as a result of these actions, a total of $38.9 million will be made available for repurposing. And of that, $5 million will be dedicated to GP indemnity as an interim measure, actually pending identification of that long-term model for future provision.
I call Cathy Mason for supplementary.
Margaret Cancorlia. The Minister will be aware that GPs in rural areas such as South Down, where there actually is no emergency department, are very often the lifeline to their community. Do you plan on giving the likes of these surgeries any extra support to deal with workforce shortages that they are dealing with now, so they can provide a full service to their large rural communities?
Minister.
And I think the member makes, I think, a vital point just in regards to how I would like to increase those multidisciplinary team programmes that we have. So over the past number of years, my department has made significant additional investment to build capacity in primary care through initiatives such as primary care, the MDT model, and actually using our general practice pharmacist programme. And those programmes represent recurrent additional investment. So we've also previously made available significant funding to enable GPs to improve their telephone systems and accessibility. So there is work that is ongoing in regards to how we support the wider teams around multidisciplinary team, but also investing in general practice.
Thank you, Minister. Call Jim Allister.
Minister, the Northern Ireland Audit Report Access to General Practice said that in 2022-23, 5.4% of HSC spend went on primary GP care. How does that percentage compare with the percentage of the work done across the health service?
Minister.
In regards to the work done, we fully recognise that the majority of those initial assessments are actually done at primary care level. So in regards to the figure of the 5.4%, and that's a figure of 375 million that was actually quoted in the report for investment in primary care, it's not fully comprehensive, as it does focus on the elements of funding that are allocated directly to GP practices and federations. So it doesn't include elements of spend which are allocated to other health and social care bodies, and that actually includes trusts, but actually are invested in primary care. That includes a significant proportion of spend in their primary care MDT model, as well as the investment in primary care elective programme and the work on No More Silos. So investment in general practice pharmacy scheme is also captured in that money. So whilst recognising the demand for general practice for an increase in the level of funding allocated to this area in social care, my department also recognises the necessity of viewing the health and social care system as a whole. So any decision to redirect money from one part of the system to another part results in those pressures. But I would assure members that my department recognises the pivotal role that general practice plays within our health and social care system, and that continuity of the provision of health care that they actually provide is that first point of contact.
Thank you, Minister. I call Colin McGrath.
So, Deputy Speaker, Minister, you're the Health Minister on behalf of an executive which has 4 parties in it. Are you all equally prioritising the need for rural health services to be delivered and for MDTs to be delivered, and are you receiving the support that you need from the Department of Finance?
Minister.
I thank the member for his point. I can't speak on behalf of other ministers or other parties, but I can assure him that I and my party are actually and absolutely prioritising health as he would expect. In regards to MDTs and that investment in the further rollout, he won't be aware, but I can inform the House that I have actually put forward a bid into the transformation pot so we can actually recruit further health and social care staff, because MDTs originally, as I think we had in the debate last week in this House, were part of transformational funding. Unfortunately, due to the reprofiling, that is now into the baseline of my department, but there's a commitment that we maintain that MDT model, but also invest not just in the staff but also in the finance to make sure that we can roll it out across Northern Ireland.
Call Deborah Erskine.
Madam Principal Deputy Speaker, apart from the fact that I sound like I need a GP at the moment, I just want to ask the Minister, he did reference about telephone services, and one of the recurrent themes we hear is about constituents needing to get through on the telephone. In the last mandate, he announced 1.7 million for telephone improvements. I have not been able to find out exactly where that money has went to. So can the Minister detail the breakdown of where that 1.7 million went in terms of federations?
Minister.
And I'm sure the member will appreciate in a specific question like that, I don't have that data or that detail in front of me, but we'll get it to her in writing in regards to that.
Okay, question 2 is withdrawn. I call Keith Buchanan.
Question number 3, please.
Minister.
I thank the member for his question. The various waiting times for hernia repair operations depend on several factors. Those include the type of hernia a patient may have, the severity of their condition, as well as their personal circumstances. My officials have been advised that 576 hernia repair operations have been carried out in the Northern Health and Social Care Trust in the last 12 months. Given the reduced waiting list initiative funding, which has been allocated in Q1, trusts have had to prioritise this funding for red flag and absolute time-critical patients. So within my previous request for funding in the recent budget exercise to deliver additional waiting list initiatives, it had been my department's actual intention to target £4 million this year at supporting approximately 800 of our hernia patients who have been waiting for the longest period of time. But unfortunately, the budget allocation provided has not targeted that resource.
Keith Buchanan for supplementary.
Thanks, Minister, so far for the answer. Minister, can you advise what part the private sector plays or played in those numbers? And as well as that, if an individual goes to the private sector or referred from the trust, and then they're not, the private sector is not fit to deal with that person, and they go back to the trust, where are they at on the list then?
That would be for a trust to answer. Not if the member has a specific case. If he wants to write to me, I'll follow up in regards to that. But again, those waiting list initiatives would have been using the private resource actually to support our core health and social care services as we were delivering those specific questions. I think what the member asked was the number of hernia operations in the Northern Trust. So in regards to that specific support that was available there, we would have been using waiting list initiative money to actually engage with the private care sector to do that work. But if the member has a specific case, if he wants to contact me.
Thank you, Minister. I call Tom Buchanan.
Question number 4.
Minister.
I thank the member. Short break and respite care provide valuable opportunities for children and young people with complex needs actually to spend time away from their parents and primary carers, whilst also allowing parents and primary carers to have a break from their caring responsibilities. So across Northern Ireland, respite care for young people with complex needs and severe learning difficulties is delivered by the 5 health and social care trusts in partnership with the community and voluntary sector. So access to and the frequency of short breaks is dependent on individually assessed need. Our short break provision in Northern Ireland for young people with complex needs and severe learning difficulties who are being cared for at home may comprise of overnight periods of care in a short break residential unit, day or overnight periods of care with an improved care, support care services provided to the young person in their home that actually enables the family to engage with other tasks, befriending services, community activities or day trips. Short breaks and respite services are also provided by the Northern Ireland Children's Hospice for all children with a life-limiting condition across our 5 trusts. And my department officials continue to work with the Northern Ireland Children's Hospital to plan for a more sustainable future, because it is acknowledged that regional availability for young people with disability is a pressure across our trusts, and there has been an increase in children and young people reported to have a disability, and there has been an increasing demand for access to short breaks and respite services. And my department continues to work with each of those trusts in terms of closely monitoring regional service provision for both young people and adults.
Thank you, Minister. I call Tom Buchanan for our supplement.
Thank you, Minister, for your response. But Avalon House in Omagh was a facility that was used for respite care for these families. That was then over COVID was closed and made into full time for a few patients, leaving now that the families in Omagh have no place to go for respite care for their families that are disabled and learning disabilities. So, what message am I to take back to them today, having met with them? To take back to them as to what care is going to be provided for them in the Omagh area where they have nothing at this moment in time.
And I think the member does raise the point in regards to the repurposing of a number of our facilities to look after those long-term young people who actually need that more intense care as well. Because I do recognise that because of the reduction of facilities, or the reduced number of facilities that we currently have, but also the workforce as well, that actually been able to provide placements for those young people was actually an ask for political representatives from the area as well. So it is about that displacement, unfortunately, why we actually build up our capacity elsewhere. So with regard to planning for the future, I have initiated a task and finish group that has been established by my department to finalise the adult learning disability service model and the children with disabilities framework. So further to that, the department has established a children's services reform process to actually reform our children's services, while we look at where additional facilities and additional provision can be met as well. So it is an area where I said in my initial answer that we're seeing that increased demand, that increased pressure, but also that increased acuity in regards to the young people that we are now supporting as well to that. So we're trying to fit what facilities we have, supported by what staff we actually have at this minute in time to meet the higher needs. And it's unfortunate and not something that I want to see continuing, that those other parents and families are actually losing out in those respite services as well.
Colonel McAllister.
Thank the Minister for his answers so far. Minister, Elaine in my constituency has a son who has severe learning difficulties and autism. Recently she posted on Twitter photographs showing the violent consequences of one of her son's outbursts, which just illustrate how he has been failed and she has been failed. So what can the Minister tell me that I can tell Elaine and other families like her who desperately need emergency respite provision?
As I've said, Deputy Speaker, in regards to the pressures that we're currently seeing in that respite provision in regards to the facilities we have, but also the staff that we have, we are seeing that higher level of acuity, more intense cases as well in regards to that. I haven't seen the message that the member refers to, or the individual that the member refers to as well, but we do recognise that there is more to be done. I am challenging our trusts in regards to that provision across all areas so that we can actually improve those respite facilities, also not just for the long term but also for short break provision as well. So to gain a better understanding of that provision across the region, as I said, my department has developed a monitoring framework to capture that monthly data, and the Children with Disabilities framework is also currently being finalised by my department in response to that increase in challenges faced by families of children with disabilities and the corresponding difficulties experienced by trusts in meeting what is a rising demand and increased complexity of need.
Justin McNulty.
Will the Minister join with me in recognising and praising the wonderful compassionate care available in respite facilities such as Carcor and Oaklands and my constituency in Armagh, and what an important lifeline that is for families? And has he given consideration to a regional unit to accommodate the greater demand, which families are often left out in a huge limb because of inavailability and inaccess to respite when it's been scheduled, but because of complex cases is not available?
Look, and I do think the member, I don't know the facility he speaks of directly, but I can be assured, Deputy Speaker, if the member's praising it, it is worthy of praise in regards to the service it's actually providing. In regards to the establishment of a larger regional facility to look after those more complex cases, look, I would rather that we had more localised facilities, though that families actually remain close to the contact of those who are actually seeking respite rather than to travel those further distances. So I'd rather that we were able to invest and repurpose some of the facilities and upgrade some of the facilities that we currently have and add additional capacity to them, rather than looking at an additional cost of rebuilding a regional facility as well. But I take the member's word in regards to the facility that he mentioned at the start of his question.
Cara Hunter.
Deputy Speaker, and I'd like to thank the Minister for his answers so far. Minister, I too am working on 2 cases at the moment to do with respite care, and parents are struggling significantly. Their children have complex special needs and they cannot find adequate provision at this time. Will the Minister commit to commissioning an independent evaluation of the effectiveness of direct payments, which are given to carers of children and young people with complex needs, often as a poor alternative to adequate respite provision?
In regards to those additional payments, I'm not sure in all cases they are considered as a poor alternative. There are some families who actually value those payments and actually make full use of them. If the member has specific concerns and anyone who is receiving those direct supports or payments, I'm happy to engage with her further in that area as well. But as I've said in previous answers, we are seeing that mismatch in regards to demand, but also that increasing complexity in regards to that. I haven't heard a call prior to the member. I've been asked to initiate an independent review of those payment processes at this minute in time, and I'll take that under consideration.
Call Stephen Dunn.
Thank you. Question 5, Principal Deputy Speaker.
I thank the member for his question, and I was pleased to recently give my approval, as I said earlier, to the 24-25 General Medical Services contract, because I believe that contract is an important step to achieving greater stability across general practice, and it makes significant progress, including provision of dedicated funding for indemnity costs. A key aim of the new contract arrangements is to provide GPs with that greater certainty over their income throughout the year, and the specific provision of £5 million of funding towards indemnity costs as part of the overall basket of measures designed to actually support the ongoing sustainability of primary care. So in the context of a very disappointing budget settlement for my department, I believe that this ring-fenced allocation will actually make an important contribution towards supporting GPs with their clinical negligence indemnity costs. However, it's important to be aware that the issues impacting the sustainability of general practice are much broader than simply the indemnity provision. So we need to acknowledge that there are a range of issues facing general practice which are complex and will require a sustained long-term response. So the provision of support for indemnity costs as part of the 24-25 General Medical Services contract is just one of a range of measures that are being implemented to secure the ongoing sustainability of general practice locally. So as an Assembly, I do believe we need to work together to ensure that we get the funding we need for health and social care, so that we can ensure the long-term sustainability of provision for those that we serve.
Thank you, Minister. Stephen Dunn for supplement.
Thank you, Principal Deputy Speaker, and thank the Minister for his answer. And I do recognise the significant challenges that GPs are facing right across the country, and I do also welcome progress on this funding. However, what more can be done to improve our GP services, given that many sick and elderly people, including within my own constituency, continue to have to queue up, often very early in the mornings, just to try and get a telephone appointment with their GP?
I refer back, I know the member's question was actually in regards to indemnity cost for GP services, and I think as I raised earlier on in answer to the first question was actually in regards to the revision of the GMS as a result of those actions. There's an additional 38.9 million that will be made available for repurposing. 5 million went into indemnity. The remaining 33.9 million has been added to core global sum payments made to practices. So again, in regards to that investment from multidisciplinary teams, but also that ask that came from GPs in regards to supporting the indemnity, but also how we worked around QAF, that quality framework, in regards to how we actually replaced that with that quality assurance framework that now removes that administrative burden, or a lot of that administrative burden that our GPs were raising concerns about. We can actually move that forward and see them actually progressing and spending what they were raising concerns with, that they were spending more time on administration and enable them to see more time where they can actually see patients.
Call Paula Bradshaw.
Deputy Speaker, and thank you, Minister, for your answer so far. Just picking up on the last point there around the administrative burden, and I'm just wondering, Minister, to what degree are you engaging with the community pharmacists alongside the general GPs to see how they could better work together so that more patients can get access to care and treatment? Thank you.
And again, I think the member makes that valid point that is often raised in here, that there's no one part of our health service and health and social care service actually can work or works in isolation, but it's how we come together and works in all those parts as well. So I was able to announce recently in regards to the community pharmacy, that overarching framework as well, that we've both agreed between Community Pharmacy Northern Ireland and my department about how we can look actually to be expanding the services that can be supplied, can be provided in community pharmacy. Again, there is a financial ask that comes along with that, one that I'm unable to meet at this minute in time, but one that I've always recognised in regards to community pharmacy, even during some of the most challenging times of the pandemic, how we're able to utilise and leverage a skill set, a professionalism that is there, that we can actually support primary care and not just see it as GPs, but see it as a more holistic approach across Northern Ireland.
Glenn Patsy McClone.
Thanks very much indeed, Minister. Minister, can you confirm if the level of financial assistance offered per GP for indemnity is on a par with that offered to GPs within the UK?
I think what the member refers to is actually what was initiated in the rest of GP was actually that state-backed indemnity scheme. It's not something that we were able to replicate directly here in Northern Ireland, but if we want to move, I believe, to that further, that enhanced package, which could be indemnity scheme, it is where I believe that our Northern Ireland GPs can actually join that state-backed scheme, which looks at, supports GPs across England and Wales. As I said in an earlier debate, I actually met with Minister Andrea Leadsom yesterday, who is Minister responsible for primary care, and it's something that I raised once again with her, that there is a possibility, or there should be, I believe, a possibility that Northern Ireland GPs should be able to join the provision of a state-backed scheme for indemnity and see how that actually moves forward as to the next step. So this is the first time the £5 million that we've actually put into indemnity payments for GPs is the first time that has been done in Northern Ireland on this scale, and I think it's shown an example of the commitment that we have within my department and I have towards general practice.
Call Alan Chambers.
Question 6, Madam Principal.
Minister.
Madam Deputy Speaker, with your permission, I'll take question 6 and question 13 together. The 34 million which has been earmarked for waiting lists, which is coming directly from the UK Government and which has already been long announced, does not even cover half of what is required to maintain red flag cancer and time-critical patients. So my officials are currently working with trusts to examine if it is possible actually to displace other hospital services to fund the amount of the remaining investment needed. That in itself will cause significant damage and disruption to our services. So if we are unable to fully do so, it will lead to longer waiting times and reduce the amount of care available to red flag and time-critical patients, and that would be, I believe, deplorable. This is also a missed opportunity to improve waiting lists where significant progress could have been made. There has been no additional funding over that from our executive provided for tackling our waiting lists. Had I been allocated the funding I bid for, there would have been an initial focus on those people waiting more than 3 years. Over 28,000 patients waiting more than 3 years for treatment would have been treated, and over 57,000 patients waiting more than 3 years for a first outpatient appointment would have had an appointment. So instead, I believe, unfortunately, our waiting lists will continue to grow, which stands in stark contrast to other supposed commitments that tackling them was going to be a priority.
I call Alan Chambers for supplementary.
Thank you very much, Deputy Principal Speaker. Minister, I thank you for your response, and I find it frankly shocking that despite all the various commitments that were made both before and after the restoration of the Assembly and the Executive, that when push came to shove, not a penny extra has been allocated to target wait lists. Could the Minister provide a snapshot of what could have been achievable in terms of numbers had his bid been fully allocated?
And I thank the member for that point as well. And I think these are figures that I have recently, and my officials have recently advised to the Health Committee in regards to that work of that original bid that we had made. Funding for that bid and included that bid would have included 6,000 patients waiting over 4 years on a dermatology outpatient assessment, 4,400 patients waiting on knee and hip replacements and other orthopaedic procedures, 4,200 patients waiting over 3 years on gynae outpatients assessments, 1,100 patients, many of whom are children, waiting over 4 years on tonsillectomies, 2,800 patients waiting on cataract procedures, 2,100 patients waiting over 3 years for a rheumatology outpatient assessment. 20,000 patients could have been seen at mega clinics across a number of specialities. Madam Deputy Speaker, that's a snapshot. Many more patients could have been seen for a number of other procedures.
Thank you, Minister. Call Patsy McGlone.
Question number 7, please.
Your question 13, Patsy. Your group was 6.
Well, question number 3, Jake. Question number 13.
You have to ask a supplementary, Patsy. I'll move on.
Take your time, Patsy.
You're Michael or Patsy. Okay, I'll call Diane Dodds.
Thank you, Madam Principal Deputy Speaker, and thank you to the Minister. Minister, my understanding is that in the allocation of additional money, the Health Service got almost 50% of that allocation of additional money. And in the first debate in this Assembly, you promised us an update on the elective care plan. A few weeks ago, you promised me that within 2 weeks you would deliver the plan for the reconfiguration of hospital services. As of this morning, we have no paper from the Department of Health on the budget for discussion tomorrow. So, Minister, we would like to see a plan to deal with the issues and within the resources that you have.
Those are currently working their way across my desk at this minute in time. The member will be aware that I haven't accepted the budget allocation that I've been given, because although it is over 50%, it is a decrease of 2.3% on what we actually finished last year at, in regards to comparing where we were financially with the allocation in regards to pay increases and pay pressures as well as to currently where we are at the moment. So that work has been done. It has needed a recalibration in regards to what we were expecting as a department in regards to financial supports as to actually what we received.
Call Connie Egan.
Thank you, Madam Principal Deputy Speaker. Thank you, Minister. Could you please outline for us how you will use the money allocated to you to tackle waiting lists, and are you going to be proactive and look for efficiencies across your department?
Yeah, I can absolutely assure the member that I have, as I referred to when I was talking to Ms Dodds in the earlier answer. I have an updated assessment as to where we were on the elective care framework that I first published in June 2021, that would have seen an ambitious investment of £570 million that would have tackled waiting lists over that 5-year period. Unfortunately, that finance wasn't there in the 2 years that this Assembly hasn't sat, and there's no additional monies at this minute in time earmarked for this financial year in regards to that. So we have continued to work at where we are in the elective care framework, looking at those day case procedure units or overnight elective care centres or rapid diagnostic centres or post-anaesthetic care unit beds, as to how we actually utilise the resource that we currently have in regards to how we actually make use of that fuller estate. In regards to, I suppose, the financial outlook, I've also engaged a GIRF report with getting it right first time and brought in some of those professionals from England in regards to looking at our back office management spends across our trust as well. They're currently in place at this minute in time. Deputy Speaker, our trusts will come forward, or have been asked to come forward by the end of this year the end of this month, apologies, as regards to looking to the impact that their budget allocation will actually have in regards to what procedures they think they will have to actually cease.
Sorry, Jonathan, the Minister's run the clock down. I can't get asking you question number 8. Yeah, you look really sorry too, Minister. So that ends the period for listed questions. We'll now move on to 15 minutes of topical questions. Before I call Colin McGrath, I wish to remind members that an urgent oral question has been selected on the infected blood inquiry, and it will be taken after question time. So I call Colin McGrath.
Well, Deputy Speaker, Minister, tomorrow junior doctors across the north will strike, causing disruption to services and delays to the delivery of healthcare and patients here. Has your department done absolutely everything that it can, and has this executive done everything it can to prevent this strike? And if so, then why is it still taking place?
Minister.
I thank the member for his point. I believe that my department has done everything that it can in regards to the limits that we're currently under. I met with the junior doctors this morning and made it very clear in regards to the challenges where they are coming forward for additional pay asks that I don't have the financial capability to currently do that. If the member looks to even the Fiscal Council report that was published recently in regards to the concerns it raised in regards to potential or further industrial action, because the large amount or the large percentage of the additional monies that was provided to this executive back in February for the restoration, the most of it went in pay package or those pay commitments that have been previously made for 23-24. And at this minute in time, and I was straight with the junior doctors this morning, as I am with this House, that I don't have the financial capability or flexibility to actually add any additional monies to that. I'm actually concerned about how I'll be able to honour further pay awards that may be made this year, or pay recommendations that may be made this year by DDRB, but also Agenda for Change.
Colin McGrath for supplementary.
Thank you very much. Can the Minister confirm then that negotiations will continue and that he will undertake to work with his executive colleagues to try and find a solution so that our junior doctors can get the pay that they deserve to be able to do the work that they need to do within our health service?
Minister.
Absolutely. Look, in regards, and I think I had a good conversation with our junior doctor committee this morning in regards to, and I think it was about recognition in regards to where I recognise the strains and the stresses that they're under, the remit that they have to seek further pay settlements in regards to this industrial action, but they also acknowledged the challenging position that I'm currently in regards to the budget allocation that I have. So while we continue to talk, we continue to negotiate, we'll continue to engage at all levels in regards to that, and I think it's subject to a debate later this afternoon as well.
Colin Kilderney.
Minister, you will be aware of the situation that applies whereby there's an anomaly between social work students who travel across to England to study social work, don't qualify for the bursary, and they don't qualify here, putting them at a disadvantage to both their counterparts in England and here. Can you update as to whether that situation is being looked at?
It has been, the member will know it has been an issue that has been raised before, where those bursaries and those supports we provide for students who study in Northern Ireland, and unfortunately, again, not just because of financial constraints, but any Northern Ireland student who decides to study outside of Northern Ireland isn't able to access those at this minute in time. It's something it's something I would like to be able to look at, but again, it's about investing in the workforce who are currently here, investing in our students that are currently here under the remits that we currently have.
Gilderney for supplementary.
Given the pressure that there are on social work vacancies and the pressures that's placing on teams, and I don't think it's a case of people deciding, I think it's often a case of people not securing a place here, and then in an attempt to become social workers and potentially come back here to work. So I'm asking, Minister, can you consider how those will be supported, or how much it would cost to meet that bursary for them?
And I think part of the challenge is in regards to that. While I would like to do it, and I think the member clearly identifies and he's fully cognizant of the pressures that are currently on our social care workforce. Again, we have I have a bid going into the transformation pod that currently sits with the executive in regards to those additional places under MDTs, which is actually looking at another 40 social work training places here in Northern Ireland, so I'd like to be able to make sure that we get that support from the executive, but also that we have the financial package to support them as well while they get through their studies as well. My concern would be, and I think the member will realise it's a genuine concern, if we extend that provision to social workers, there then would be a duty to extend it to any student who went to study across the water in regards to receiving those financial supports as well. So it's not something, and the member knows me well, it's not something I'll rule out, but it's something I'd be keen to explore, but I'd also be far more open to be able to increase our social work training places here at home, rather than having the unfortunate situation where people have to go and study social work with the potential of coming back here across the water.
Well, Cathy Mason.
Can I ask the Minister for his assessment on the current crisis that's facing children with special educational needs?
In regards to the engagement that we have across both the Department of Health and the Department of Education as to how we actually support and make sure that we have that engagement and a joint working to make sure that the child's actually at the centre of the support that we have. I'm keen if the member has any specifics that she wants us to raise with me in regards to that. If it's a specific case or a specific example, I'm happy to engage with her on that or follow up in the supplementary.
Cathy Mason for supplementary.
Yes, the Minister will be aware that children and the families of those children with special educational needs are present, filled with fear and anxiety about getting their child a place this September in school. Can the Minister just outline what is being done within his department and working across with the Education Department as well to ensure that children are statemented adequately and have access to the allied health professionals that they require?
And I think in the last point, having engaged with the Education Minister, it is about how we make sure those allied health professionals are there with the best skills, actually to support our young people as they go through education. And again, and I don't think I'm bragging any confidentiality, we have, again, through the transformation funding that is available through the executive and the financial package, there's a joint ask and in between ourselves, education and actually justice, to increase the number of training places for speech language therapists, because we realise there is a deficit across those education, those early years supports, as well as we need to support that as well. So there is that cross-working, that cross-determination to make sure we're meeting the needs for our young people in regards to the supports of those allied health professionals that they need access to.
Call Paul Bradshaw.
Deputy Speaker. Minister, you'll be aware that a national patient safety alert was issued last week by MHRA, warning of the impending shortage of the 4 groups of medicines for the treatment of ADHD. What is your department doing about this?
I thank the member for her point, and while supply disruptions of some ADHD treatments have now been resolved, my department is, again, as she's aware, of ongoing supply disruptions, including various strengths and preparations of other ADHD treatments, actually across the UK, which has been caused by a combination of manufacturing issues, but also an increase in global demand for these products. And as the Department of Health and Social Care, DHSC, actually leads on the maintenance of medicine supply chains to the UK, my department has been working closely with them and other devolved governments and the Medicines and Healthcare Products Regulatory Agency to ensure that the impacts of these shortages are mitigated and that patients continue to get medical supplies they need. There are national and locally tried and tested mitigations in place to deal with medicine shortages, and during the period of supply disruption of medicines and treatments, communications have been issued to healthcare professionals across health and social care settings, which have provided advice and appropriate actions to take to manage patients affected by these disruptions. So it is anticipated that ADHD treatments currently affected will resolve at various dates between this month and September of this year.
Paula Bradshaw for supplementary.
Thank you, Minister, for your answer. I suppose I am concerned that there are families out there who, because they can't get through to their GPs, they are worried. Obviously, it's a condition that can cause great anxiety, and I'm just wondering, in what ways can your department or the Public Health Agency actually improve communications directly to patients as opposed to relying on GPs to convey the message?
And I thank the member, and I know this is an issue that was raised in the media last week, and did receive some coverage at that point as well. But again, in regards to the direct communication would be through the medical professional who's done the prescribing rather than my department. We wouldn't hold that level of detail as to who they are. So the National Patient Safety Alert, which was issued actually by the department, which was reflective actually messaging, which was agreed across the United Kingdom. And again, the supply disruptions were initially expected to be resolved at various stages actually towards the last year, but there has been challenges in regards to certain prescriptions, certain medications that are ongoing. But again, we are hopeful that they will work their way out through the system between May and September. But as I've said, Deputy Speaker, these are unfortunately supply challenges that are being seen not just here in Northern Ireland, but also to supply chains across the United Kingdom and again on a global level.
Call Connie Egan.
Thank you. Minister, can you please outline for me what action your department is taking to ensure that GPs are fully resourced so that everybody in North Down who needs an appointment can get one?
I thank the member for her question, and I'll move further than North Down, Deputy Speaker, if I may, in regards to the answers that I actually provided in oral questions at the start in regards to the work we've done on the GMS contract and being able to repurpose 5 million of that in regards to the indemnity that their GPs have accessed, the move away from QAF to that quality assurance framework, which should free up more time as well, but also the further investment that I want to do, and I think we all want to do, and that's that further investment in our multidisciplinary teams, which should see that access to primary care actually move quicker. But again, Deputy Speaker, Principal Deputy Speaker, this is about a long-term investment rather than a quick fix.
Connie Egan for supplementary.
Thank you. Minister, Priory and Spring Hill Surgery in my own constituency and others have patients queuing outside first thing in the morning to be told they can't get a GP appointment, or patients phoning up as soon as the phone lines open and being told that in a matter of minutes all appointments are gone. What do you say to those people who need a GP appointment?
What I say to those members, and if the member has a direct complaint to make against Primary and Spring Hill, I think she said, I'll provide her with the details of where she can actually make those, because she will be aware that the contract held by that practice, that's the initial route of access as well. My department has established a GP Access Working Group to explore issues relating to the access to services and to oversee work to improve the experience for patients. That group includes representatives from general practice and service users amongst its membership, and work is ongoing to develop guidance for practices in the management of patient demand and actually optimising workflow within practices to maximise efficiency. That group's also considering how technology can and is being utilised to help develop improvements to the process for accessing services for patients and practices alike, and one of those workshops is planned for this year. But again, I do hope the member has raised those concerns directly with the practice itself rather than coming here to air them initially.
Donny Donnelly.
Speaker, just to ask the Minister what is being done to maintain the adult neuromuscular outpatient care service to provide continued uninterrupted provision of Ridazepam and the associated required services for eligible patients.
I thank the member for his detailed question in regards to Ridazepam. I would need to get back to the member in writing in specific in regards to that. It's not something I have in front of me today, so I hope the member accepts in regards to that specific medication. I will revert to him either in writing or if he's a follow-up supplementary that he wants to expand on.
Donny Donnelly for supplementary.
Thank you for your answer, Minister. I look forward to that communication. There was an urgent, two-day urgent written question last week that still hasn't been answered. So I would just ask him what he's doing to reassure and to communicate with those patients about that service.
I think the member, I'll follow up on his urgent written question as well, because I'm sure it's not been made for any headline grabbing opportunity, but due to a real concern that has been raised specifically with him. So, Deputy Speaker, I'll give you my assurance and the assurances to this House and to the member that I follow up on that for him.
Number 7's withdrawn of the deadline. I call Alan Chambers. You've 1 minute.
Thank you, Deputy Principal Speaker. Minister, with just a week to go before this Assembly is asked to agree this year's budget, could the Minister provide an update on his engagement with the UK Government and ministerial colleagues on the issue of the shortfall in health spend this year?
I thank the member for his question. He may be aware that when I was in Westminster yesterday, I also engaged with, as I've said on a number of occasions, with ministers from the Department of Health and Social Care, but also the spokesman for, or the Shadow Secretary of State for Health in regards to West Streeting, in regards to highlighting the concerns and pressures that we're currently facing in health in Northern Ireland, especially around the budgetary process. And I can be assured that I continue to raise my concerns with executive colleagues in regards to what I see as a financial shortfall in regards to the allocation that has been provided to health going forward to the budget process next week.
So that ends question time. Mrs Diane Dodds has given notice of an urgent oral question to the Minister for Health. I would like to remind members, if they wish to ask a supplementary question,